lot of, well, I have gotten a couple people recently getting out of prison with really bad athlete's foot between their toes. So yeah, if you look at them there and it's white or if it's green, you need to come and see me because you need some antibiotics, especially if you just got out of jail, because you probably got a bad case of athlete's foot.
That takes a while.
Well, they have to, so what those, I have to start you off probably with some betadine to put between your toes. I have to culture you to see what's living in there. But I start off with a baseline antibiotic that normally, for the bacteria that normally lives there. But sometimes they have a whole family. So they have multiple things living there. So I need to get that culture, especially if I start them on an antibiotic and it's not clearing.
What do you mean?
They may have some cousins. They got this, that they may have some Pseudomonas, then they might have some fungus in there. They may have some yeast in
So
there.
at that point, would you start your patient's treatment?
Oh yeah, well they may be taking multiple things because they may have to be on an antibacterial, they may have to be on an antifungal. And then if they're going on the antifungal, then we're talking about liver function. So yeah, and then they have to be on a topical as well, like a betadine or something to dry out the area. Then they got to be on a daily regimen of drying between their toes. I mean, it's a whole process, but I've seen some pretty severe cases this past year, actually. So yeah, but if it's turning colors in there, it's starting to smell, it's cracking, it's green, especially if it's green, you need antibiotics.
So you mentioned you have been seeing a lot of patients with
Fasciitis.